Good day to everybody. Good morning, good evening, wherever you might be. This is Demystifying Generative AI, the good, the bad, and the practical. Generative AI might be something you may have heard about. And so today we're going to give you some helpful hints and sort of demystify what's going on and also give some strategy on how generative AI, good and for bad, I know because this is an NHCAA webinar that the focus is on the bad, and we'll spend quite a bit of time there as well. And thanks to NHCAA for hosting this. We're going to start with some introductions. So I'm Tom Riggins. I'm the Senior Manager and Global Lead for Healthcare Fraud Compliance and Risk. I've been with SAS for coming up on 6 years. Previous to that, 10 years with some other large companies. And so sort of a thought leader in the industry. For those of you that have attended our webinars before, you've met most of us. We tend to have a good time here. And so today we're going to continue on with that. And I'll turn it over to John Maynard.
Hi, everybody. I'm John Maynard. I'm a principal solutions architect, which means I'm also like an industry consultant. Been with SAS for 6 years. My background is, before that, I had 25 years in state and local government, primarily in the Medicaid space, but also in social benefits. And that's kind of what I do. So I support healthcare on the public side and on the private side, pretty much anywhere, including around the world. Right, Tom?
Yeah. I'm coming to you tonight for everybody's information from Seoul, Korea, where it is actually 2 a.m. So forgive me if I have a little scratchy throat. Jason?
Yep, so I'm Jason Denovi. I'm a healthcare fraud analytics consultant here with SAS. Been here for about 2 years now, and prior to coming over, I worked for commercial healthcare payers, building out the analytics to detect fraud, waste, and abuse. So I've worked in special investigation units. I've worked in payment integrity teams, kind of partnering up with the SIUs as well. But bulk of my career really just looking for providers who bill for things that they don't do. So I'm happy to be here. So move on from there. Just a quick disclaimer, educational purposes only. I don't think we actually even have any data in here, so don't need to mention that it's fabricated. And in general, just don't launch new investigations based solely on what you see here in the presentation. All right, and then a quick agenda. So what we're going to do is we're going to talk about artificial intelligence and generative AI and really kind of compare the two. Where does generative AI kind of sit within artificial intelligence? We'll talk about what are some of the risks that are now inherent with AI and really how are bad guys using them. And then we'll kind of go into some use cases too, talking about what can we actually do with AI and with generative AI specifically, to help ourselves and be better at what we do. All right, so starting off here, we've got a couple definitions, right? Because I think to understand generative AI, you've really got to have a little bit of a background in understanding artificial intelligence. So I'm not going to do too much reading of slides here, but we'll do this just for these specific definitions. AI is just such a broad category. There kind of are a lot of definitions out there. So, for SAS, we define this as the science of designing ethical and transparent systems to support and accelerate human decisions and actions. And the key there really is just anything having to do with human decisions or actions, right? So if you think about actually something physically that a human can do, trying to replicate that, whether that's driving a car, moving an arm like a robot arm, or then also the decision end, the information end of that as well. So helping you make determinations, even when it comes to claims coverage. And then within that, generative AI is a subset, right, of artificial intelligence that's designed to generate new content. And that's really the key thing here is that, when we think about artificial intelligence, I've kind of been referring it to as a traditional artificial intelligence. A lot of times the point there is that you're taking information and you're training an AI so that you can actually predict something or you can classify, right? You can do something. But with generative AI, you're actually using that kind of input data to create more data. So, that's really the key distinction there. In terms of the visualization too, I like this a lot because it really just helps you identify, again, where generative AI really sits within that entire world. So artificial intelligence being that very, very broad category of anything where we're trying to replicate what humans do. Machine learning sits within there. And that's what I think when we talk about algorithms, we talk about models, we're generally kind of referring to some of those machine learning processes. So identifying those subtle patterns that people may not see, right, but that your system can, and really doing this pattern detection. Deep learning is a form of machine learning. Oh, yeah.
Yeah, I just want to jump in because it's one of the things that we're seeing all over the place, and it does get a little bit confusing. So I'm glad you talked about traditional AI versus generative AI. But what we're seeing, and even here in Korea, we're here meeting with the government agencies here around fraud, waste, and abuse, and they just refer to it as AI. And so it's really important that we understand what people are actually talking about, because they are sort of conflating the terms into just AI. And so thank you for really separating that out. And we'll do that throughout this presentation today. That'd be great.
Yeah, absolutely. That's definitely going to be a recurring theme. And so, and not to go too much into depth with this either, you've got the whole deep learning subset that's neural networks, and that's really beyond the scope of today's conversation. Natural language processing, I think, is important to just have a basic understanding of, and it really is just what it sounds like. It's being able to take the way that people speak and engage and be able to change that into usable data. So that's really how generative AI works, right? So it's one of these very complex kind of deep learning algorithms that heavily involves natural language processing.
And that's what people use every day, Jason. So when they say, call my wife, call home, or hey, Alexa, natural language processing.
Yeah, exactly. And I think that's exactly why this has just been so powerful, right? Over the last, are we coming up on 2 years or year and a half or so since all this has really been introduced. So moving into some of the risks, right, with generative AI, the biggest concern that we have, obviously, is that if you have something that can just generate information, right, the biggest risk is that you can create any level of documentation. So you could create something like medical records, you can create things like medical imaging. So what we're looking at here, and for anyone who's attended, I think we've talked about this a couple times, right? So we've seen these examples of, here's an evaluation and management record describing a visit like that. So try to take it kind of to the next level. Been playing around with this a bit. And so I used ChatGPT in this case to actually take, this is an evaluation and management that has to do with genetic testing, right? Ends in the referral for genetic testing. And so what he did was had it actually generate that record, but then asked it, could you go ahead and access a specific payer's actual policy, because they're generally public, you can find them, just feed in the link to that policy, and can you actually change the verbiage that's in this medical record just to make sure, that I'm capturing everything that's going to be required under the criteria for it to be covered. And so then beyond that, asked it also, can you describe what are the changes that you made to the medical record? And that's what we're looking at here, is actually it reading into that payer's policy and then saying, here are the changes that were made.
So that's really, Jason, that's if people are following, which I know this group is, recently there's been a lot of talk about the use of actually providers being hired to go in and mine medical records to make sure that for, increased reimbursement that they're putting in, extra diagnoses to increase the complexity of the claim. And so here's a great situation where, generative AI will be able to do that much more efficiently and at a greater speed. It's kind of risky. John, you were going to say something?
Yeah, some of those EHR systems will actually prompt the physician to, ask a question or make sure that they're doing something. And so that can sort of help pump up their reimbursements. But if that weren't to happen, and now imagine you could take this generative AI piece and put it on the back end and just have it go through all of your records for the day and say, did I miss anything? And have it put in all the stuff that you want, so you can start bumping up, which kinds of codes that you're hitting against. It's amazing. So Jason has been, for those who don't understand what he's been doing, is what we always do. We're always trying to look for ways to steal money. So he's using it as a white cap. But, we're trying to see what we can get it to do to help steal money. And it's very, very efficient at giving us some stuff. So.
Yeah, absolutely. And so, I mean, even just the little things here, I do actually just want to point this out in case anyone's reading it and they might be rolling their eyes at the first one here, but it's giving the medical necessity justification that, it added that this is consistent with the payer's policy for genetic testing. And of course, that doesn't really add anything into the record. I would almost bucket this in like the hallucination category. Like, sure, I guess it's not literally false, but it just has absolutely no value at all. So just to demonstrate that, of course, these things aren't perfect. The second one, I think, actually speaks to it much more, where it actually finds the language within the policy and then makes sure that it does emphasize that significant family history. And so, like, I went back into the policy, I found that language too, just to confirm that, yeah, it really did adapt it and it made sure. And the power there is, of course, all these providers and all the different contracts they have with all the different payers, they're going to have slightly different criteria. And so they can just do this, at scale, just so much faster than they would have been able to do this before.
But you, Jason, would use that anomalous language there to recognize that somebody had done bad, that someone had asked this to, it was maybe GenAI produced.
Yeah, absolutely. And as we get into kind of the use cases too, this becomes a great opportunity to start looking for, what are some of those tells, right? Is this almost too close, too identical? And so got this here too to talk about social benefits a bit, because obviously, right, it's not just healthcare. There's a lot of overlap and a lot of these same challenges that everyone's facing, regarding generative AI, and whether that is just misrepresenting whatever it is you're doing through falsely substantiation or falsely substantiated documents, right? Having a lot of volume to deal with, having all of your different data issues. And then obviously there's a lot of manual review that's required, that's time consuming here for people. So, I'll pass it off to John to kind of elaborate a bit more on that.
Yeah, I like this slide because I have a social benefits background. So I used to determine eligibility for things like cash assistance and food assistance and Medicaid, and I did nursing home Medicaid too, which is very difficult. But it kind of is kind of cash and carry into other places. So really the ability, in that world, we have put our application systems online. So you can go online and you can get a form, you can see the forms, you can see the rules. And so using GenAI, you could point it toward those rules, and then you could have it fill out these forms, in a mass space in terms of filling out lots and lots and lots of applications for many, many things. When you combine that with, I think, what we've seen on the cybersecurity side, where you had these data breaches and, folks had your name, your address, your social security number, they could take that and they could use this and use GenAI to sort of create multiple cases in those systems. I also like it because it reminds me of the time I used to work at financial services, and I was had the health company. And one of the things that we would see is we were always worried about those applications that were coming in for policies. And from here, I'm thinking body brokers. If I have stolen data and I maybe don't need to be a great body broker, because I can use GenAI to create these identities and create these applications. I understand what's going to go through underwriting and how to get the lowest rate possible. Am I actually going to pay for these policies? Yeah, but I'm going to pay for them with the money I steal, because no services will be provided. I'll have a provider I'm working with on a kickback. We'll get the money. We'll pay to keep these policies in place, and it's all fake. But how many of those brokered bodies could you create using GenAI versus how you would have had to do that in the past? And how much better and cleaner is your application going to be, because you can know exactly what to do to get it through underwriting and get the lowest rate? So it scares me. That's the point. It freaks me out, because you can do bad at volume and at scale.
Yeah, one of the things that we've talked about is one of the biggest risks of GenAI, and Jason and I actually have a white paper that's about to be released in a couple of weeks, and we'll provide a link to that when that comes out to all the attendees here. But one of the things we talk about is the fact that generative AI, if anything else it's doing, it is lowering the bar of entry. So before, when you had to have a little bit of medical knowledge to be able to create false claims or false applications and things like that, now with ChatGPT or other generative AI tools, and we sort of use those terms synonymously, but we all know that there's multiple tools out there. That's just one of them. But with generative AI now, that bar is lowered to where you can just ask it what the fraud that you want to commit, what do you want to create, and it will go out and look through the large language models throughout the world for the information that you want. So you don't have to have a whole lot of knowledge about medicine anymore to get involved in this, or social benefits for that matter.
Yeah, there's an interesting question in the chat about how do you detect standard response similar to cut and paste formula from the provider just to receive a prior auth or push claim through processing. It's interesting because we're using AI to help automate some of those prior authorization pieces. So it can read in the documents, it can understand, it can index them. So a reviewer is able to look at them and say, what I expect to see or what I need to approve or disapprove is here. And so the flip side is you could use GenAI to generate those that someone like us would then take in, and they know what we're looking for because they understand the policy. And I think Jason understands that sometimes the next wave here is going to be what is the tell in the GenAI piece. For me, it's always like we can run analytics to show that when this went through prior authorization, this doctor says the same thing about every single one of their patients. Like the blood pressure is the same. There's something like some of that stuff is the same. It doesn't make sense that all the patients' diagnostic data would look that way. But what Jason has shown us is that you can use GenAI to create those types of records and tell it to mix it up so it's not all exactly the same. So I think it's going to be harder, but there are ways I think that we can get in and to begin to look. So it'll be AI versus AI.
Yep.
Yeah, absolutely. And in the meantime, too, I think because we're early on, you do sort of read these examples of kind of low-hanging fruit that are these tells, at least for now, where literally sometimes pieces of somebody's prompt winds up in the final product. So you'll see something like, please generate for me, and somehow that winds up somewhere in the document. You'll see, you'll see words like generate, regenerate, etc. And they're starting to get better now at coming up with these sort of statistical analyses of different types of words and language that are just kind of overused and overemphasized by large language models when you compare it to known written things by people. So I think there are those methods that are becoming available, and in the meantime, you'll still continue to catch crooks doing dumb things here and there. And so wanted to talk about really synthetic data too. So again, as we were talking about before, what really stands apart here is that you are taking training data and you're essentially creating more training data is the way that this works. So we talk about it in a couple different types of media. So you can do this, with actual text and language. You can do this with images. You can do this with audio. And you can also do this too with actual, table-like data. So like your Excel files and literally the way that we're used to seeing kind of structured data can be created as well. So it's funny with Tom mentioning earlier that you think about trying to add in additional diagnosis codes or actually taking the language and then add in the actual data that's going to be input, sort of that more like entry data that's standardized. That is another risk that's present as well.
And Jason, I think about
Jason, I'm going to jump. I'm sorry, go ahead.
Go ahead, Tom. No, go ahead, Tom.
I was just going to jump in because we've had a couple of questions in the chat, and I just want to answer them so we don't keep getting the same ones. I can't answer in the chat, so I have to answer verbally. We will make the slides available. If at the end of the presentation, you'll see there's some QR codes. So if you don't get a copy of them, you can reach out to either of us or any of us, and we'll make them available. I just wanted to say that because a lot of people are asking.
Yeah, sure thing. No, absolutely. Sorry, John, I didn't interrupt you.
Oh, I was thinking about like synthetic data generation, in the voice piece. We were sort of talking about the voice piece before. So we know that we have the old scheme is call centers calling into people's homes and trying to get them to, buy the braces and then get their Medicare numbers and stuff like that. But there's also the piece now where, you can create voices, right? So you can use GenAI if you capture a sample of their voice. We talked a little bit about how people are using it to trick people out of money and those sorts of things. But I was thinking that if it was me, what I would do is just like build a collection of old people that are on Medicare and their voices, and then I would have them. And then when they die, what I would do is I would generate these conversations where they had ordered my braces and ordered all of this stuff from me, and I'd have the records, and then ultimately I'd backbill for them after the date that they died. And you could never take them into court to testify against me, because I have recordings that sound like their very voice, saying that they authorized all the stuff they wanted it, and you have a dead body to drag into court. So it's a pretty good scheme, and I also think people should check providers that backbill a lot of claims after a patient's death. If you haven't done that lately, you might want to look and see what pops up.
Yeah.
Yeah, and it's scary too, because I feel like, so we've talked about this in the past, right? We've talked about kind of the concept of the idea that you could actually interact with an AI, right? A voice generated AI kind of over the phone live. I kind of pitched it previously, like several months ago, as something that, is probably off in the future at some point. But then you have, OpenAI just had their demo. What was that? Just a few weeks ago, a couple weeks ago at this point, where they demonstrated, here's what do they call it, ChatGPT 4.0. And so, and it all of a sudden has become so much more lifelike. It's just become, it actually sounds like you're talking to a human. So I just feel like if you were to look at like almost the doomsday clock version of that, it's like we've kind of hit 11 o'clock on it, that like you can actually be talking to somebody live. So really want to transition to talking about some of the use cases and things that we can actually do with these technologies to better ourselves here and how we can work more efficiently, right? Because the general theme here is that while a lot of what we're seeing, may be somewhat new, but you're really just doing what you used to do. Fraud is still misrepresenting. It's just happening faster and higher volumes. So, what can we do to be more efficient? So medical record review is a perfect opportunity for that, because anytime you're trying to think of a use case, just unstructured data, right? So anything that's handwritten, anything that has to do with somebody just manually writing things down and it's not a table, that's a great opportunity for you to think about how can we try to incorporate text analytics and generative AI into looking at that. And so, even just trying to classify different types of documents here, if you think about a medical record that's just hundreds of pages long, and then you have different types of notes in there, right? If it had to do with PT, right, you might have all your different visits. You might separately have evaluation and management. You may also have the visuals too, the medical imaging. So you can actually even just categorize that stuff and just make it faster for you to be able to perform your review and have things organized. And also,
it's interesting, Jason. The fact that we still in the United States have handwritten documentation is pretty crazy. And one of the things I've learned here in Korea this week is that they don't do that here. Everything is electronic. If you want to get paid, it has to be an electronic submission. So, that in and of itself, if we, could start to move towards that in the United States, that could alleviate a lot of issues as well.
Hey, being able to read handwriting is how I got a job as a pharmacy tech when I was a teenager. Because I could read doctors' handwriting and nobody else could. So that's kind of sad. Maybe some young kid would like to break into healthcare and they may miss their opportunity. I think this is really good pace, because you can think about this, like if you're doing, this is where like prior auth, if you're you could use this type of technology. You could use this if you were going to be doing like quality reviews on cases, so that you're going out and you're finding the high quality records, the most advantageous to you to move through your work. And that will then expedite how many of those types of quality reviews you could get done, or how many prior auths you could get done. So I think there's a lot to be said for this in this space.
Yeah, definitely.
No, absolutely. And I see a question here too about how do fraudsters get around the requirement for Medicare or Medicaid number for the application. Does you have any thoughts on that?
Usually they already have it, because there's been so many data breaches. You can either call in and trick my mom into giving you her Medicare number, which she did, and my sister's a nurse and she's been told 10,000 times, never, 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 still did it. Or they're all on the dark web. There's just all of these breaches that these medical providers are releasing all of that kind of data out into the wild. And now you can use GenAI to create everything else around it to start billing.
Yeah. No, absolutely. And something I've been thinking about too, again, with the medical record analysis, is once you can kind of take all this information and move it into a more structured way that you can actually analyze it, that's when you can start getting into, now that we may not necessarily expect an exact template record where somebody has the same exact blood pressure every time. Even if it is changing, if they're being generated in some way, the odds are it's probably going to be some sort of pattern that doesn't appear to be natural. So you may just be able to take 10 different visits and they've gotten blood pressure taken for that same member. And then, wow, this just looks like either they're not changing enough, or maybe they're just changing wildly, way too much that doesn't make sense, but it just doesn't match the pattern of what you would normally see. And we could really analyze that statistically.
Yeah, and Jason, that's one of the areas where, because I work in lots of different parts of healthcare around fraud in clinical research for pharmaceutical development, that's one of the big concerns, because there it's not so much about the money being stolen, because there's really not a way to do that other than creating fake trial subjects. But even with that, the money is very low. It's more about validating the data. And so you don't want the FDA, when you submit your data for this billion-dollar, multi-billion-dollar blockbuster drug, for the FDA to come in and find like, hey, why is it at this one site, every single blood pressure on every single day is exactly the same? Or, one of the things, this is an actual case, was discovered was patients or subjects have to complete these online electronic diaries. They give them an iPad and they complete these diaries. Well, the one agency found that all of the diary entries for this one site were different when they were entered, but they were all entered within 2 minutes apart. And also it was at midnight. So clearly somebody was fabricating it so they could get it done because the subjects weren't doing it. So that kind of statistical, being able to find those anomalies in the data, or I like to say the signals in the data that can point you in that direction is pretty significant. And SAS does that in a lot of places. So it's one of the areas, including this medical record review. We're working with CMS regarding that right now. Doing medical record review for prior authorization approvals and disapprovals. So it's a huge area where we can help.
Yeah, and fraudsters tend to be sloppy. Even I think with GenAI, they're going to be sloppy. So if they might say, hey, mix up my blood pressure values, if they didn't tell it to within something that's going to mean the patient's still alive, they could give you a blood pressure where, if you're a nurse or clinician and you look at it and go, they should be dead. Like, you can't live through that. Your head would pop off your body. I think we're going to have to start looking for the weird mistake type things that GenAI is creating. Because remember, when they create, dozens and dozens and dozens of these records in minutes, they also means they don't have the time to go back and look at everyone. So they might just look through a couple and they look good, and they don't realize there's stuff downstream that would tell anybody who knows what they're doing that this can't be true. So we're hoping that they continue to make those kinds of mistakes.
Yeah, and I'm sure they definitely will. And it's just a perfect example of just, again, kind of the low-hanging fruit and those simple tells that at least for now, especially, while this technology is still more in its infancy, I think those are going to be easier and easier to find early on. All right, so another area too that we wanted to talk about is case management. And so just like with medical records, this is another area where there's just a lot of unstructured data, right? You have people who are making notes, investigators are writing down particularly what they did, who they talked to, how'd that conversation go, and then you have paragraphs and you just have a lot of information to work with there. So it's another great use case, and there's just a variety of things you can do there, even if it's as simple as summarizing the data that's there, right? Like if you get a call on somebody else's case, or if you're a manager who has to go ahead and review that case, rather than having to literally sift through all these different notes or what are the last 8 or 10 things that happened, you could potentially just hit a summarize button or have some way of finding out what's going on with that investigation.
Yeah, another use case here that I think about, Jason, is an investigator's ability to get into care management notes. And so, when I was in Ohio, we had 4 different vendors who did that for us for our waivers. But for the state plan, we sort of did it ourselves. But that stuff the nurses would go out and they would do their home visits. They would take notes. They would just get PDF'd and they were sitting there. So there was unstructured data. And we can take that, we can structure that data and then we can start analyzing it. And I can tell you that I found some fraud cases, not because of our analytics or anything else, because I had gone into these notes for some reason and found what was in there. There was, was bad patterns, and it's certainly affecting patient safety and quality of care and those things, but it's all buried there. So now you can unleash, this type of technology into that space and bring the insights that are there into an investigator's fingertips or to a care manager's fingertips. Someone looking at quality patient health.
Yeah, and it's interesting that you mentioned that too, but actually being able to find something there through the notes, because that really speaks to, again, being able to identify information that's free form there and that isn't structured. So, I've got that listed as intelligence gaps here, but if you think about it too, when you're working in a case management system, if you wind up getting new phone numbers or addresses, other identifiers that you didn't necessarily have in the beginning, you have a tendency to write within your case note, well, I called this number because I was told by the person who picked up I need to call this number or whatever that is. And so you tend not to necessarily always enter that information into that separate kind of table. There's usually like an entities area that has your medical provider, has your different participants, your different subjects, and you're expected to add in every phone number, every address, and this becomes the structured data that analysts are using to kind of create the different networks, or let's see who is involved in different cases. So a lot of times there's valuable information that's actually sitting within that case note. You know, here's a phone number for somebody that may pop up somewhere else down the line, but you'd have no idea because it was literally just inside that case note.
Exactly.
Yeah, and then, you know, beyond even, you know, the summarizations too, I mean, you could also just ask very specific questions. If you need to know how many times have I tried to contact this provider, they claim that you didn't, you know, you could just quickly go, instead of having to go through the entire file, you can see, great, I made X number of phone calls, I've sent these letters, and you can see everything you did, just again, with very, very specific questions and just easy things to, you know, query, but it's in plain language.
And I also think that you know, if you were a peer or you were a manager and you know you needed to get information about a case, you could use GenAI in that way to say, can you give me a quick summarization of the case? And so we use natural language processing, machine learning to do that in all kinds of spaces now. And there's where you can sort of do that. And so you could get a really quick read on what's this case about and what do we know? And then you could ask questions of the, you know, maybe you're talking to somebody and say, well, I never got anything. And say, well, how many times we make contact? And it comes up, right? You'd be able to say, you know, they've called you 5 times, they've sent you 10 letters, blah, 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 blah. So then yeah, I think there's a lot of utility. So that creates a lot of efficiency, because otherwise you'd have to wait, you know, for them to come back, or you'd have to ask them. And, you know, there's just a lot of back and forth. So I think you can start seeing these things being used to sort of create some efficiency.
I think also, John, one of the things that I've seen it used for, especially around some of the solutions we have in our policing side of the world, is being able to go through the case notes that are entered and find linkages where a person's name might get mentioned in multiple types of case notes. So, you know, if you have a physician who's mentioned in 15 cases that are being investigated and it's the same physician, but because you have a large department with lots of cases going on, you know, you may not notice that Dr. Johnson, you know, is mentioned so many different times in so many different cases, and it can bring that to your attention. That's another way that using case notes and being able to run those notes through a generative AI process will really make things more efficient and spot problems before that sort of collusion or organized crime group gets the foothold.
Yeah, and they may not be the target of your investigation. And there's ways that we use to do link analysis. So we'll use analytics to do link analysis, and we may use claims and other data to really sort of be able to pull that together. But this could be times when they're not actually on the claim, that you don't actually have that data to sort of pull them together. And the difference is you've got investigators who are talking, they're looking at other cases, and this person's name or this address or this place, you know, keeps kind of coming up again and again. And, you know, it's just kind of metadata buried there inside your cases, where GenAI could find it and say, hey, this person is in fact in 8 of your open cases, and here's what they're saying about them. Because that's the person you want to call, right? That's who you're going to call and go see.
Yeah, absolutely. And because I know that was an issue that we came across where years ago at this point, but finding that, you know, we had very, very similar cases in which people were trying to pass off basically cosmetic surgery as being necessary, you know, within like an emergency room context. And what was happening is they were actually being advised by, you know, basically like a professional billing advisor or whatever he calls himself. But yeah, it doesn't fall into that bucket of being a provider himself, you know, so where does this information go? And so exactly like you said, this is where you just come across this again and again. And so you could identify this within documentation without necessarily having to wait to the point where multiple investigators at some point put that together, realizing, hey, wait a minute, we've got a case with this person too. Hey, this is the same guy. What's going on?
Yeah. So someone put a question in the Q&A box, which someone else sort of followed up on, but it's really an interesting use case. They have a provider who's arguing that his error rate should only include codes that he manually enters as opposed to the EMR system using GAI or other things, because the software is actually entering codes that he's getting dinged on. And then another question was around, are these companies, EMR companies, using GAI to sort of scan through the EMR system to find those claims and then find those codes or things that can be coded and put them in. I don't know, Jason, if you've seen any of that happening, but that's certainly a pretty interesting defense that, oh, the computer did it, not me.
Can I take that? I can tell you the answer to that is that somewhere before you submitted your claim to me when I was in Medicaid, you attested that those are true and accurate. And so you're responsible for the claims that you submitted. And if you have purchased a system that is upcoding and you don't know it, and I have seen that happen, you're still responsible for that. So we've argued that. I'm not telling you who, but we have seen that happen where it was sort of upcoding things, and there were glitches in the actual system. Okay, you bought that system and you're responsible for that, but you're responsible for your claim, so you're going to pay it all back. And if you want to sue the company that you have, right, for your electronic health records or EMR that's doing your coding for you, feel free to do that if you want to get the money back from them. But have you been doing all your updates and all your patches on your system? Well, now you have IT auditors coming in to fight about who should be paying, but you're responsible for the claims that you submit. Or that somebody submits on your behalf that you don't know about, like when your wife does the billing or your coder's stealing your money, or you're responsible for that too.
Yeah, I think, that's going to be an interesting defense. I mean, I agree with you, John, and, they sign documents stating they are responsible. But as this becomes more and more of a back of the office process being done by software rather than people, that people are going to fall into that defense. So it'll be interesting.
They already have. Yeah, they already have fallen in that defense. And ultimately, it's like, it's your software, you're responsible for it. And so it's like, well, did you actually do these things? No. So should I pay you for those things? Yes. Now you're asking to commit fraud. You're trying to commit fraud because now you're billing for a service. So the federal law will say, right, under false claims, once you know that the mistake is there, you're responsible for paying back the money if it's Medicare or Medicaid. Right. And so I don't really care that your system had a problem with it. You need to pay it back. And I'm sorry, I hope it doesn't hurt your budget and you don't have to close up shop. But that from a government side, it's just straight compliance. I can't not collect the money back from you because I think something's silly or your system's goofy. That's not how the rules are written.
Yeah, as my lawyer father used to say, ignorance of the law is no excuse.
Yeah,
exactly.
And somebody says ignorance. Yes, ignorance is an aspect of a case now, and ignorance is always in your cases because intent is what creates fraud, and ignorance is, well, I didn't realize that that's what's happening, so I didn't commit fraud. Now we're just in abuse, and you can't put me in jail for abuse. You can't ban me from the programs for abuse, but you can for fraud. So it's always, well, I didn't realize that your policies are so strange, coding so difficult. I got 1,000 reasons why I should know this. That's why it's harder to get to a fraud prosecution. And why it's hard to do it in court. It's confusing to a jury. Someone said you can't fix stupid, and Lord knows that's true.
Yeah, Sean said,
That's Ron White right there. Point, Ron White.
Yeah, but to your point, John, though, ignorance only works in my mind. Ignorance only works once. Like, oh, I didn't know.
Right.
Okay, don't do it again. Well, you do it again, that's intent.
Yeah, we would do education and we would document it, and then when they did it again, they would say, you went through education, you signed up and said what was right and what was wrong, and now you're doing it wrong, so it must be intentional. So it's easier to get them to cop to something, get the money back when you go down that road.
Yeah, so Michael's asking if there's any software on the market that can ID the use of GenAI in electronic medical records. I don't really know of a solution or a software product specifically for that, but that is certainly something that you can use SAS for. We have what we call our visual investigator that looks for those signals in the data like I was talking about. So you can spot those anomalies. You can spot things that I used to say look hinky. And whether or not it's generative AI created, that's a whole different type of spotting of information. I'm sure it can be done, but a lot of times, just like the copy paste issues that we deal with, where every patient has the same blood pressure, or the lab value never changes, or something like that. Those things can be spotted. So the technology is available to do it. I don't know if there's a specific software product, Jason or John, if you've heard about that. I don't know.
No, not that I'm aware of. No, John, you know something?
No, I don't know of anybody who's got one on the market right now. I'm sure everybody's trying to develop it. I'm sure we're trying to develop it. But it is because we're advancing, I think, in terms of trying to spot it has been generative AI. And in some ways, sometimes things are just too perfect, right? So what I do know about when human beings type records, or they, if they're doing what they're doing by hand, or they're sort of filling them out, is that they will sometimes misspell words, and they will sometimes, their grammar isn't quite right. And it's funny because now Gen AI is getting so good at being, have perfect grammar, right? You look at Bard and all the stuff that's out there. Sometimes I think things will look too perfect, and that would actually be the thing that catches my eye. I do think there is metadata left behind in the crumbs, but you'd have to know when it was generated. So when you look at those documents, if those documents that get created are faxed to you, you've lost all of the metadata of how the electronic record was created. But if you can get back to the source electronic record, there should be something in that data that would tell you that it was generated that way and how it was done. So IT audit in a new Gen AI world will be even better. So now you not only have to know healthcare and investigations and data analytics, now you have to know IT audit to do the job.
Yeah. And it'll be interesting too, right? Because I mean, when you get down to it, I guess the interest is not even necessarily identifying, hey, what's been created by generative AI, as much as just what's here that didn't actually occur, right? What is actually the thing that's being misrepresented? Because while I'm not aware of any products that are looking for that specifically, that are trying to identify what's been created by Gen AI with the medical record, there are plenty of companies that are working on solutions that are trying to actually help providers create those medical records with generative AI. And obviously that's out in the open, and it's a legitimate use to try to speed up your process. So it just creates these very strange gray areas then, where they're going to be legitimately creating documents with Gen AI versus illegitimately, right? Fraudulently doing that.
Yeah.
So
and I understand why they'd want to do that. I mean, my own GP told me one day that it takes 142 clicks for him to go through the EMR system for a visit with me, just a regular checkup. And I was really surprised by that. And I think, I know some people might not be, because I know somebody in our group has a spouse who works in that space, right, in creating medical records. But I was just surprised that, the administrative side of what's happening with the software, which should make their lives easier, it always hasn't made the lives easier of practitioners. I'm sure there's some nurses and doctors on this would say, yes, it's sometimes a pain in the butt. But, so given that, it makes sense that they're looking for tools that would sort of help them get done what they need to get done and see more patients and spend more time delivering care versus this administrative piece of, filling out the software and that stuff. So it makes sense. But anything you can use for good, you can use for evil.
That's exactly what I was going to say, was that all the things, anytime something is done to make our lives easier, it makes it easier for the bad guys too.
Yeah, it does.
Yeah, definitely. And just wanted to know one more thing here before moving on from this slide too, just to cover, because we were talking about efficiency gains, and we've made a point again about actually synthesizing data, creating more of what's been input, but really just thinking about how much more quickly you could actually generate your own letters. That you have these different communications with the providers, and particularly if we are talking about, hey, now I've got an excuse of, I had generative AI actually coding this thing for me. But, the reality is you have your demand letters, right? You've got the provider education letters. And so rather than necessarily, right, we have templates that exist now, but it should be easier to do kind of the reverse of what I talked about earlier with trying to update the medical record based on policy. But, you should be able to basically, in very simple words, be able to tell it, hey, I would like to generate a letter that's going to reference this policy and explain what the issue is here with what we've seen in these claims, and then just actually have it reference that proper language and maybe your denial codes or anything else that you actually have in your system there.
And a lot of what we're doing, a lot of what we're doing around our a couple months ago, there was our big convention of the year for our users called SaaS Innovate, was held in Las Vegas worldwide. People traveled from everywhere to get there. We announced some new products, and one of the things that we are launching and was announced at Innovate is something called SaaS Copilot, which basically can do exactly what you're talking about, Jason, where there are abilities to use the natural language processing and the natural language discussion with the Copilot portion of it to create letters using the information that's in the policy and in the record. And, instead of having to have somebody, type up a template that you then mail merge and have to, figure out how to make the data go in, the SAS Copilot can basically do that on the fly. So the efficiencies are definitely going to be there. And I think that's probably the biggest thing around generative AI, and what's going to be in healthcare is going to be around those efficiencies for good, but also efficiencies on the other side too, lowering the bar and letting people in the door.
Yeah, I know somebody at SAS who they work in an area where a certain percentage of the hours throughout the year have to be billed a certain way or to a certain thing, because that's how their metrics for their performance for the year. And they actually used it to create a spreadsheet that would calculate that for people on the fly. So where every week they can go in and it's created a GUI, they put in their data in a GUI through an email, and it feeds into this spreadsheet in the background, and it tells them whether or not they're on target to meet their annual goals. And so it was done with the Copilot space. So now that's automated. That email goes out every week, and folks just fill out the stuff in the GUI form, and it pulls it into the spreadsheet, and it tells them whether they're on track or not. So they can go in and put in like where they plan vacation and stuff throughout the year and see what's going to happen. And that's how the whole thing was built. Nobody coded anything into the spreadsheet. Nobody coded anything into the emails. Nobody coded anything. It was all done through AI. And this is a software company where they're coders, and they're not coding. They're using AI to code and build these things. And it was a great tool, but operationally, how long would it have taken somebody to actually put that together? And then how often would they have to send it out every week? It's all automated now. Yep. Somebody in this session's thinking about how can I get that and use that now in my day.
Yeah, I'm thinking about it myself, actually. Yeah,
I can tell you who to call. I know who did it. Angela did it. Angela's incredibly bright.
No, that is actually a perfect introduction to this, John, because wanted to also just kind of touch on something that's, we're talking about, all this potential, all these things that you can implement right into your system. But the reality is a lot of people probably just don't have them right now. Right. So wanted to talk about what are some things that you can actually do now as an individual. Of course, obviously, always check, your corporate policy, and don't take my word for it. I probably need to put that in the disclaimer, actually. But just to really, if you haven't used any generative AI, what are some things that you can do to kind of get started? So just kind of put a list of different things here that you can do. And it starts with really just learning about it, right? Reading different blogs that exist about it, looking at videos online, and then just actually trying some of these products. Right? We keep mentioning ChatGPT, of course, because that's the big one everyone knows. Google has Gemini. And I mean, there's just a plethora of these that are out for all types of different tasks as well, too, that are kind of specialized. So there's a lot of different things you can do there.
Yeah, and I think, Jason, one of the things that I've learned from you as you've become sort of our team's, guru around generative AI, is that it's the prompting that is really important. And that's where that learning and experimentation really comes in handy, where, as you do this, you'll learn the way. It's not just the question you ask, it's the way you ask. And that really becomes vital to getting the results that you want even quicker. I mean, obviously it's moving very quickly, but you don't have to iterate your statements over and over again once you learn how to prompt these generative AI tools.
Yeah, Jason gives it follow-up questions or follow-up commands to refine it. And what I would say, I haven't seen your stats, Jason, but when we originally started talking about this, probably last spring, you were probably 15, 20 minutes to create some really good fake records. Are you at 5 minutes? Are you at 3 minutes yet? Because I feel like you've gotten good enough at it that you've sped up your process for how fast you can get it to generate naughty things. Bad things that you're trying to create.
Yeah, you know what the scary thing is, not to talk myself out of a job, but something else you can do too is just literally ask it to write the prompt. Yeah, exactly. Is just actually prompt it to write your prompt for you, right? Like recommend a prompt that I can use to get this result. It becomes absolutely ridiculous at some level. It's crazy.
And I see chatbots in there. And so Jason and I were talking about this morning. So the traditional chatbot is designed to, like, let's say if you're calling into a call center or customer service, it's looking for certain things, and it'll say, you're interested in, getting the balance on your mortgage, and you say yes. And it's using a decision tree. So it has a finite system of things that it can do. It's in a box, and once you say yes, I'm interested, then closes out those branches of that tree. It keeps moving you through the tree with follow-on questions to figure out exactly what you want and how to get you there. If they can't do that, generally I ask it things that it can't answer, and I get really, really frustrated. And I'm sure hands are going to go up here if you got frustrated with the chatbot. But it eventually says, "Let me give you to a human." And I was telling Jason this morning, I think the new wave is GenAI in some places is the new human that sort of boxed in chat box can give you, because it can open things up and it can think outside of the box. It doesn't have the kinds of rails that the traditional chat bot would have as we think of them. And so I think you're going to see more and more of, that's what you're going to now. But you do have to have some rails on it, right? Because we've seen things, I don't know if you guys have seen the funny stories in the news. We do, because we look for them, where somebody has released a GenAI, on their website, and it's like for a car dealer, and the people are asking it all kinds of crazy questions, and it is not talking about cars. It is, it's talking about how to build nuclear bombs and it's giving you all of this because they didn't put any rails around what it could conceptually do. So there's that problem too, right? This technology has to be used in an ethical way. It has to be used in a smart way as it's being implemented. So I think it'll be interesting as we go forward.
Yeah, John, it's and this is a thing to bring up. One of the things that I've been discussing with here, there's a department that does all the medical reviews for the country of Korea. And one of the things, they're very interested in generative AI, but one of the things I spent a lot of time talking with them about is understanding what it can do, what it can't do, and what you shouldn't let it do. And I think, talking about those guardrails is really important. And that's why, SAS has a whole department around trustworthy AI. We have, members of our executive leadership team sit on the President's Council around that. And so we're very interested in that. But you do have to remember, because it seems like it's acting on its own, but we also have to remember that any generative AI chat bot or generative AI tool has been programmed by a human. I mean, they're not programming themselves yet. But it has been programmed by a human, and so all of our biases that we have in ourselves, get inserted. And I'm sure everybody here is aware, Google Gemini was trying to be so inclusive that it was forcing, the tool, when you asked it to create an image of George Washington, it was putting up a picture of a George Washington who looked Native American or looked like, and it was creating, pictures of Nazis who were Asians and things like that, just, it's not reality. But because a human programmed it to do things in a certain way, that's what it does. So we can't forget the fact that a lot of this is programmed by humans. And so the way we do that and making sure that AI is trustworthy and unbiased is really vital and important.
Yeah, and I'm not the data scientist here, and I'll lean toward Jason, who's much closer to one than I am. But what I do know is that when you create AI and machine learning models, you're using training data, and if there's bias in that data, there'll be bias in the models that you create, and it's important to remember that and to understand that. And so, like with our stuff, there's stuff built in that's looking for bias as it goes along and does its work, which I really appreciate. Because that's not something I would necessarily see. But I think, sort of beyond that understanding is that when you move into this type of large language models, if there's anything in there, that data that's biased, and there is, it's going to have that same bias unless there's a way for you to sort of build some rails around that. But you have to be careful how you do that. And so we're still in our infancy, but it's going to be a wild ride.
Yeah, absolutely. And I do want to make sure, since we have just a few minutes left here, that I do leave some time for some questions also. We've got the just some quick takeaways here, and I think hopefully this was all woven throughout the presentation in general, but right, volumes of things are going up. We're not seeing too much that's extremely novel, right? People are still just trying to bilk you for your money, essentially. Those volumes are going up, so what can we actually do to increase our efficiency? And then when we look at things like medical records, you're probably not going to be seeing the same exact template again and again. So these things get a little bit more targeted, a little more nuanced, a little more sophisticated. And, of course, before you jump to everything and anything that an AI can do, you can definitely very easily initiate yourself by kind of starting with some of the more little personal and smaller tasks, to get used to kind of how it works. So I don't know if anyone has any closing thoughts on that for opening up, or.
Yeah, so there's no way for people to actually verbally ask questions. So we have 5 minutes left. So I'm going to ask everybody to if you have questions, go ahead and put them in the Q&A entry section, and we'll get to those and read them because we can see them on the screen here. But Jason, I think one of the things that, the walk before you can run is really important. And one of the things that I talk about quite a bit, and it's in our white paper that's coming out in a couple of weeks, is around understanding what generative AI can do, what it can't do, and understanding that many of the things that you think generative AI would be useful for can already be done using what you've coined the term traditional AI. And so, SAS as a company has been using traditional AI in our solutions for over 40 years. So we're not new to that. It's not a buzzword for us. And so it's built into everything we do, the machine learning, the AI into that. And there's many things that we do already today that, function perfectly well, and you don't have to use generative AI. So understanding how deep the water is before you jump into it is always a good idea. But we do things around text analytics that generative AI can do as well, and maybe do it in a more conversational way. But we can still deliver those results today using traditional AI. So it's really important to understand those things. And I think generative AI is the cool new buzzword. It's out there. Everybody wants a piece of it. And I think it holds a lot of promise, but we're still in early days. Things have been moving really rapidly. And so it's one of those things that I think we just really need to be prudent in how companies and organizations implement it and use it in what they're doing. And what you don't want to do, which we've seen with some of these managed care organizations getting on the wrong side of CMS because they're kicking old people out of nursing homes, is allowing the algorithms, the analytics, or more importantly, the generative AI to be making decisions on human lives without human intervention. And that's something that we don't want to go there with. So again, if you guys have any questions, put them in the chat. I'll sort of turn it over to John and Jason to finish up some other comments here. We don't have any questions so far.
Yeah, I think there'd be two things I say. One is, since I do work on social benefits, I say don't take the human out of human services. Somebody needs to be looking at those things. We do see places where folks have released models and say, oh, deny benefits, deny this, deny that. And they're not always understanding why, and it's improper. And so when we look at healthcare and we look at social benefits, it's important to make sure that we get that right. So that's one of the things I'd say. My other takeaway here is that Jason didn't talk about it a lot today, but sometimes when he asks it to create records, one of the things he was doing was going out and saying, whatever code, just says 99215, and it would say, he would say, create me a record, for an office visit with a 99215, and then it would do it. But then the thing he did is he turned around and say, if I were a coding auditor and I wanted to see if this was compliant, is the record compliant? And it actually went out and found the rules and said, no, you're missing these two elements. And then Jason said, can you put those in? Sure. And then it fixed the record so he audited his own thievery with the machine and got it to fix it so that it would be right. And, as an auditor, it scares the hell out of me how easy it is for him to do these things. Because, to understand coding, which I don't, is not, no one can, but not all of it. But, it's difficult. It can be really, really complex. And just to have the machine just do it like that was freaking me out, Jason. You're freaking me out all the time.
Yeah, I think it speaks well to, again, we think about automation versus keeping somebody in the loop. I think it's something that you both alluded to here. And that's a big part of why when we read that definition early on, right, that it's actually saying that this is to support human decision making. And so that's just the biggest thing. It's iterative, it's helpful, it can move you along, but I really try to stay away from the idea of just full automation.
So I'm just going to quickly say thanks to everybody for being on the line.
Thank you for showing up today.
Thanks, everybody.